Hello everyone. Good morning. This is Vivi. I'm back with another video. So this is for Navodaya staff nurses, and this is some model paper for you guys. The fourth model paper I have got for you. So before diving into the video, don't forget to subscribe our channel, The Nightingale Tales. So let's dive into the video. The first question: the immunosuppressive drug used in renal transplant recipients is. So we all know after renal transplantation or any organ transplantation, we'll give immunosuppressive drugs so that that organ will be accepted by the body. So the commonly used drug for kidney transplant is sirolimus. Okay, the sirolimus is a drug of choice, mainly a immunosuppressive drug used for cases in renal transplant. Next, question number 2. The lifespan of CD4 cells in the human body is. We all know CD4 cells are important in immune system. So what is the lifespan of CD4 cells? That is 100 days. Like RBC's lifespan is 120 days, CD4 cells will also have lifespan, and that is 100 days. Next, while ambulating a orthopedic patient or client, on which side to the patient should a nurse stand? So whenever you are transporting a patient from a ward to investigation room or ward to some ECG room or from one ward to other ward, so on which side a nurse should stand? So obviously the nurse should stand on the affected side. If the right limb is broken, then the nurse should stand right to the patient, or if the left limb is broken, the nurse should stand on the left side of the patient while transporting the patient. Next, question number 4. The best example of saddle joint is. We all know there are many types of joint: ball and sacred joint, hinge joint, every joint. We all know there are 6 types. So saddle joint example is carpo-metacarpal joint of the thumb. We all know the thumb finger in the and the 4 fingers. The thumb finger stands for the best example for carpo-metacarpal joint. Next, longest muscle in the body is sartorius. So the longest muscle in the body is sartorius. Like longest bone is femur, the longest bone is sartorius. Next, the 5 P's should be assessed in a patient with traction. So whenever the patient, orthopedic patient or a patient with cast or POP should be assessed for these 5 P's. So what are the 5 P's? Answer: pain, pallor, paresthesia, pulse, and pressure. So the pain around the traction or around the cast should be checked, whether the person is having pain due to tying the traction or the cast more tightly. Next, pallor. Pallor is color. The color around the affected area or the color around the cast, if it is more erythematous, then we can assume that the cast is more tight or the blood supply is not good. Next, paresthesia. Paresthesia is sensation, if the person is having sensation or not due to the traction or due to some nerve damage. Sometimes the patient may not experience sensation, so checking the sensation of the patient is must important, so that we can conclude that the nerve functioning is proper. Next, pulse. Obviously we should check the pulse which is near to the affected area. We all know there are numerous pulse, like temporal pulse, femoral pulse, radial pulse, ulnar pulse, and popliteal pulse. So there are numerous pulses. The pulse should be the pulse which is near to the affected area should be checked more. So if the patient is having a neck fracture, you have to check cervical pulse. If the patient is having a lower limb fracture, you have to check popliteal pulse. Next is pressure. The pressure should be checked so that the patient's blood pressure is fine or doing better. Next, question number 7. PTCA stands for. We all know the PTCA term is mostly used in cardiology cases. So what is PTCA? So we all know angiogram, angiography. So PTCA also similar to that. So percutaneous transluminal coronary angioplasty. The repair done to the coronary artery is called PTCA. You can remember it as percutaneous transluminal coronary angioplasty. Next, 8th question. Amphotericin B is an fungicidal drug. We all know black fungus. So after corona, we are seeing the patient who are affected with the corona are showing the symptoms of black fungus symptoms or the black fungus side effects. So these symptoms are specially caused by black fungus. So the drug of choice for the patients who are affected with the fungal infections or the black fungus is amphotericin B. Next, drug of choice of hypertension in pregnancy is, we all know about pregnancy, hypertension in pregnancy and diabetes in pregnancy. So if the pregnant woman is having diabetes, obviously we can't give every drug that comes into our mind, like every drug that is used for hypertension. So obviously methyl dopa is the best drug of choice for the pregnant woman for treating hypertension. Next, 10th question, tramadol belongs to which group of drugs? We all know usually many older people in our country will take tramadol for their knee pains and every body pain. So actually what is it? It is an analgesic for sure. We all know that is a painkiller, but it is an opioid analgesic. Okay, it is an opioid analgesic. So this is the video, guys, and the comment, please comment on the answer if you know the answer, or else you can comment down how the video is for you. So the 11th question for you guys, especially for all viewers, drugs used to treat nausea and vomiting are. So if the person is suffering from nausea or vomiting, what group of drugs will give? So what is that group or classification is called? So this is for you guys, for you all guys question. So I think it is very easy. If you know the answer, please comment down in the comment section and comment how the video is, and if you want different topics to try on, please comment down in the comment section. So this is Vibi signing off. Bye.